Questions?
The infection rates have gone down considerably since the fall. Hospitalization, vaccinations up. Is it time to declare victory over COVID, and do you anticipate rescinding the emergency order anytime soon?
So we've continued to see positive progress on all of the public health measures that we pay attention to. But what I would say is that we're going to continue to make decisions based on data, and the one thing we've said all along is any decision we make with respect to reopening, we want it to be a positive one that is sustainable. And that makes us, I think in some cases, a little more cautious than some others. But if you look at how this has worked across the program since we first opened up the economy, it's just about a year ago, right? May 18th. Generally speaking, we have not had some of the blowback that have happened in other places when they opened up a little more quickly.
Governor, is there any hope, some business leaders are hoping for a July 4th reopening rather than an August 1st so they can get that extra holiday weekend in? You just cited a lot of really positive metrics. Is there any hope that you might move it up, that reopening date?
Well, we said when we originally proposed the August 1st date that there were several things that were going to determine whether or not, that was like the outside date, right? That was what people wanted from us was, you know, what's the outside here? And we put the August 1st date out there because we believed by then we would reach, even if vaccines started to slow down, even if we stopped seeing people get vaccinated and all the rest, that we felt that date would probably work. But we said at the time that if people continued to get vaccinated and people continued to get fully vaccinated and we continued to see progress on some of these other metrics, that we would consider moving earlier. I would say we've been pleasantly surprised by the continued participation of people here in the Commonwealth. At this point, if everybody who has a first dose comes and gets a second dose, we will hit 4.1 million people sometime in very early June. But obviously, this is the sort of thing we're going to continue to pay attention to.
Governor, you had said that walk-ups at Gillette were not going to be available, and I think you just said all 7. Has that changed?
I don't think I said it wasn't.
Last week, Gillette was not included in the walk-in.
Was it 6?
Last week, yeah.
So we did change our position on that? You can go ahead and talk.
I want you to see the Get Connected face covering.
Stay healthy. Good.
I'm the chair of the Connector Board. So last week we announced 6. Gillette, just because of the size, their scale, they felt they needed a little bit more time to make sure they had enough people at the front end in order to accept walk-ins. So they actually started over the weekend, people started to walk in, but it's now official. So walk in at all 7 of our mass vaccination sites.
How many people would you say are taking advantage of this? Is it almost like you don't need an appointment anymore? You can just, if you wanted to go to one of those sites?
You don't need an appointment anymore to go to one of those sites, and it's also true at many of the retail pharmacies that they're now accepting walk-ins as well.
So the traffic at the Max Finder site is probably down to just about nothing?
No, we were pleasantly surprised. People are still going onto the pre-registration to sign up. I think for some people that just provides that certainty, you know, like you will get an email or a text from us for an appointment, but people can go on the Max Vax Finder and just make appointments or walk in. So we're encouraging people to walk in, as they also are doing here at Manet, trying to take away, as the governor said, any real or perceived barriers for people.
And finally, are we getting Johnson & Johnson shipments still? Is that still like a big part of the vaccination plan here, or outgrowing part?
J&J is a small piece of our overall vaccination. I think for this week it's about 10,000 doses for this week. But it's very much an important piece, particularly for mobile and the like, and they do it here at Manet. You offer all 3.
Today and then, yes.
Right.
All 3.
Right, all 3.
One other thing I'd say about the appointments is, remember, everybody who got a first dose probably has an appointment to get a second dose. So there's still a lot of appointments that are scheduled. I mean, I would guess if we do 70,000 appointments, if we do 70,000 vaccines today, I'm guessing 45,000 of those, 50,000 of those will probably be second doses, which will all be driven by appointments. Is that about right?
Yeah, that's about right.
Governor, if you're transition to going to a more local model, what are some other ideas or things the city is doing to help push the last 30% or so of folks that might be nervous or having difficulty getting vaccinated?
I do think the walk-in stuff is a big deal with respect to that. Having We've had several places that have said to us that the walk-in volume they get is actually significantly greater than the appointment volume they get, which just speaks to the fact that appointments, well, for grown-ups, for lack of a better word, we like to have the scheduled appointment, it works for us. For a lot of other people, the opportunity to just walk in, walk up, get vaccinated is an easier play for them. The other thing I would say is that I expect if and when the feds make a decision on the over 12-year-old, the 12-year-old and up population, I expect that one will end up becoming a lot of walk-ins, and that will end up rolling out in a variety of ways. You'll see a lot of pop-ups around that. You'll see some at schools. You'll see some in supermarket parking lots. You'll see them in a variety of different places, and they're going to be based on this idea that you really want to catch people where they might be and with an opportunity to engage them and get them vaccinated.
Roger, you or your team tweeted out a little while ago that you're going to be appearing with President Biden tomorrow on this topic. Could you tell us a little bit more about that? Is that a virtual event?
Yeah, it's a virtual event. There are, I think there are 6 governors involved, and it's basically to talk about how to reach and deliver vaccines to either folks that are part of what we would call the hesitant community, or folks who are part of communities that are just hard to reach and need more help to get vaccinated. And we'll talk about some of the partnerships we've had with folks like Manit and others, and some of the work we've done with mobile outreach. I mean, some of our hospitals have actually run some really successful pop-up programs as well. Boston Medical Center is running programs with churches and community health centers and senior centers and youth centers, and I mean, there's a lot going on in that space that's, I think, made it possible for a lot of people to access vaccines who wouldn't have been able to otherwise.
Governor, do you think you could see reducing the mandate for masks indoors at any time, or is that solely something you're going to go out the feds and wait for them to give you some instruction on that?
I've always thought of the CDC as as sort of the guidepost on a lot of this stuff, and in many cases we've made adjustments to their recommendations based on what we saw going on here in the Commonwealth. I keep reminding myself that they worry about 50 states, I worry about 1. The facts on the ground aren't always the same in all 50 states, but I certainly think that for us in the short term, the message has been, you know, getting vaccinated is the fastest and best and easiest way for everybody to get back to what I would call normal. And the CDC's guidance, I think, is starting to catch up with the fact that if you are vaccinated, you can do things with other vaccinated people, and you don't necessarily. I hugged my dad when I saw him on Sunday, and it was a big toothy event for both of us. But I think I think one of the things that I would just stress to people in Massachusetts is the more people that get vaccinated, the faster our case counts go down, and the faster our hospitalization rates go down, and the more likely it will be that we will all be able to do things that we love and want to do, because we won't have to worry about infecting someone else and won't have to worry about somebody else infecting us.
But does that mean the mask mandate, since we're ahead of the rest of the country, you might choose to drop the mask mandate inside ahead of the nation?
I think we focus primarily on what I would describe as the data and the studies that come in. The data and the studies on outdoors are pretty clear at this point. But masks, generally speaking, if you can't keep your distance and you can't engage in what I would describe as safe activity indoors, you should wear a mask.
Dr. Victor, what's your reaction to the DeRosa's lawsuit now being petitioned to go to the Supreme Court on the
Yeah. I mean, I guess what I'd say 2 things. One is we don't comment generally on pending litigation for all kinds of reasons. But the vast majority of the guidance and the advisories that we've put in place over the course of the past 15 months have been pretty consistent with the public health recommendations that have come from either the feds or from our colleagues at DPH, and are pretty consistent with what most other states have done as well. And we're now on the back end of this, and if the Commonwealth and the people of Massachusetts continue to perform the way they have in terms of getting vaccinated in the weeks ahead, I think we could be in a really good place in a fairly reasonable period of time. But I think for the most part, what we've been up to and what we've done has been pretty consistent with what most others have done as well.
Last question. Can you shed some light on, the emergency order, sorry, when you might rescind that? Or, would that be rescinded at the time around August 1st when things do fully get reopened? Or what would be the benefit of maybe not rescinding it at that time?
We're still trying to figure out some of the issues around the order and the supplemental guidance and advisories that sit underneath it. I guess what I would say is that it's our view that by the time we get to August 1st, which is the current sort of end of a lot of the capacity rules and the guidance and all the rest, that would certainly be a time at which we would go to some sort of a standard that would be what I would call traditional public health standard and not something that would operate under the the rubric of an EO.
Thanks, everyone.
And thanks for coming, guys, and thanks again to Manet.
Question about transparency in the state police. We've heard that a couple of troopers have been let go recently, one including one who's dishonorably discharged and been having trouble getting information about why they were let go. Don't you think taxpayers have a right to know, why troopers are getting the axe?
Most of the time on personnel matters, there's not usually a lot of transparency in the public sector or the private sector. One of the reasons we were so aggressive about creating a post commission was we wanted to create an entity that could serve as kind of the state clearinghouse and arbiter for decisions about internal affairs investigations, complaints, certification standards, and all the rest. Because one of the major issues we were trying to address there is if somebody was removed from a police department, dishonorably discharged, or for some other negative reason, we wanted to make sure that the Post Commission was in a position to inform any other law enforcement agency that might be interested in talking to that person what the situation and the circumstances were. But it's not unusual for HR issues to be treated as a quote-unquote confidential manner. But we absolutely believe a big part of why we were anxious to create Post, even before everything, all the awful stuff that happened last summer, was because we felt we needed a clearinghouse around, especially around law enforcement issues with respect to that stuff.
And when will they be adjudicating those kinds of cases?
Pardon me?
When will the Post Commission be adjudicating those kinds of cases?
Well, remember, the commission itself was appointed about 2 weeks ago. We're going to file funding for it. We'll figure out a way to help them operate in the meantime. But their first major assignment is to certify the existing law enforcement community in Massachusetts by the end of the calendar year.
Thanks,
Do you ever
everyone.
see requiring kids to get the vaccination before being back to school, like usually a month if it gets approved for kids?
Well, we've been big believers in what I call, incentives and making sure there aren't any barriers to getting vaccinated. And that's been our approach all along, and it's been a pretty effective one. And I think that's probably the approach we would pursue going forward on this stuff as well.